Hello, Auzubillahiminash-shaytanir-rajim. Bismillahir-rahmanir-rahim. I am Dr. Shahzad Wasim from Pakistan. In this small video, we will discuss the confusion between the treatment of corneal ulcer and uveitis. It's a very small video, but it's very important from both the practical point of view while you examining the patient and prescribing him the medicine, and from your examination point of view. One thing to remember is that steroids are contraindicated in corneal ulcer. So there are some exceptions, but you need to remember that steroids are contraindicated in corneal ulcer. Uh, and but Steroids are the first line of treatment in uveitis, which is the inflammation of the iris, where we give it in the form of drops, anterior uveitis. So I will give you a brief tip, you can say, which the examiners usually ask during examination. Uh, this is a red dot bottle, and you should be knowing without picking it up that what is it. Examiner wants to know that whether you know that the red color is designated universally for mydriatics. You should be able to know by looking at the top of the bottle and saying that it is mydriatic. And Mydriatic and cycloplegic. This is topicamide. It is basically a mydriatic, but it is also cycloplegic. The prodrug is atropine, which is both the mydriatic and the cycloplegic. Coming back to the treatment, very important point is that when the patient presents with corneal ulcer, he feels severe pain, and the pain is because of the spasm of the ciliary body, because it is the same nerve which goes to the cornea, and it causes the corneal ulcer, in turn causes the spasm of that muscle to which that nerve is supplying. Similarly, the patient coming with uveitis also presents with pain, not that much severe, but it is, as you can say, it is relatively a severe pain. So in both cases, it is the pain. So one thing to remember is that if the patient is presenting to you with uveitis, you will give the, the mydriatic, yeah, cycloplegic. This will relieve the cycloplegia. It will relieve the spasm and will cause the cycloplegia, and the pain will be relieved. And with it, you will give the steroids in uveitis. So steroids and mydriatics is the first line of treatment in uveitis. Now, these steroids are contraindicated in corneal ulcer. If the patient has now come with a corneal ulcer, he will still have the pain. You will still give the cycloplegic, and instead of the steroids, you will give the antibiotic. This is moxicon. That was prednisolone. So this is moxifloxacin. So in corneal ulcer, you will give the cycloplegics and antibiotics, and in uveitis you will give the cycloplegics and any steroid like prednisolone or dexamethasone, etc. So it was a very small tip, and it is very important both practically and theoretically, and there is a lot of confusion, and you need to remember this. I hope to see you in the next video with a small clip of to for your conceptual understanding of the eye. Thank you very much.